Today is Friday and it's May 1st. Can't believe April is already over. So today on our show, we are going to have an update from Jeff Parker, and we're also going to have a segment on why wearing your mask is so important. I know we've been talking so much about them, but I just wanted to go over a variety of things as to why we've gone ahead and distributed so many of them, and you guys were so good about getting your masks, so we'll talk about that. All right, let's go ahead and give you our brain teaser for today. Now, our brain teaser is so good for us, so we're going to go ahead and we are going to tell you the question. I am the beginning of sorrow and the end of sickness. You cannot express happiness without me, yet I am in the midst of crosses. I am always in risk, yet never in danger. You may find me in the sun, but I am never out of darkness. Ooh, that's a long one. So hopefully you guys will get that one. We'll give you the answer a little later in our show. Let's first go ahead and give you our websites that we've been reminding you of on a regular basis. We have the cdc.gov, and that of course is where you can go get all of your information about COVID-19, masks, how to cope with anxiety, some stay-at-home ideas, a variety of different things there. Then we've also got our other website, which is ochealthinfo.com, and that is where you can get all of the numbers on a regular basis, daily actually, where you can find all those numbers by city. Or you could go to our website, which is Laguna Woods Village Alerts.com, COVID-19 information, and then of course your local information, which is specific to our area, Laguna Woods. Then you can email us at info@lagunawoodsvillage.com or go to our recorded hotline, 949-268-2019. And let's take a look at our weather. We had a bit of mist this morning, and we'll have that again tomorrow morning because our temperatures aren't quite as hot as they have been. However, take a look here. Oh, 94. That's not right. It's supposed to be 76. I must have mistyped there. Sorry about that. Low clouds, fog. Saturday, 76, 56. Sunday, 75, 57. Monday, sunshine, 77, 56. And then we're moving back into warmth of 83, 58. Let's take a look at our sunrise and sunset. Our sunrise this morning was 6:02, and our sunset will be 7:35. And this beautiful photo was sent in by Joel Goldstein. Thank you so much. We've had a lot of people submit some photos, so we'll just rotate them in as we can. If you have a lovely photo that you would like to send in, please send it to Laguna Woods Village TV at gmail.com. As I mentioned before, we will have Jeff Parker update right after this, so stay tuned.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
As Orange County's highest-ranked hospital, Hoag is the place to turn to for timely information, reassurance, and care in these uncertain times. Our dedicated physicians, nurses, and staff stand ready to safely deliver world-class care, just as we have for nearly 70 years. This is what we do. We are here for you, and we will overcome this together. To access Hoag for all of your healthcare needs, visit hoag.org/trust.
We consider hearing to be an essential part of your life. During this time of quarantine and isolation, you need to be hearing the best you can to understand how to stay safe and to hear your friends and family. Advanced Ear Care is offering service to everyone that needs help with their hearing aids, no matter where it was you purchased. If it's not working properly, please call for a free troubleshooting appointment. We even have hands-free, no-contact curbside service. There's no charge for this service. Advanced Ear Care is here to keep you hearing during these critical days.
Communities are starting to feel the financial impact of COVID-19, commonly called coronavirus. But we want you to know that there is help. We have disability insurance for workers who are ill or medically quarantined due to COVID-19. Paid family leave is available for those caring for an ill or medically quarantined family member, and unemployment insurance for reduced hours or lost work. We're all in this together. For information on how to stay healthy, visit covid19.ca.gov.
I hope you have a great day today.
Oh, I respect it.
There's your meals, and we'll see you later.
Thank you very much for coming.
Bye-bye.
This is Age Well Senior Services. Won't you make it yours?
Parkinson's disease is a neurological movement disorder affecting an estimated 1 million Americans, including many under age 40. The American Parkinson Disease Association is the largest grassroots network in the United States, working to help ease the burden and find the cure for those coping with Parkinson's. Visit apdaoptimism.org today to find out how you can help millions live with dignity and optimism. Your action today will help APDA put an end to Parkinson's disease.
Welcome back. Well, we've got Jeff Parker with us, who's going to tell you about something I know most of you are going to be very excited about. So, Jeff, welcome. Thank you for joining us.
Hey, good morning. Welcome to. Glad to be here on Friday morning. I should say welcome because I'm the host, right?
He wants to be the host now, don't you? That'll be great. We'll just toss it to you.
That's okay.
Yeah. So we hear there's some good news about the golf course. So very excited. So tell us what's happening.
Okay, so the first thing was on the governor's list of what activities could happen under phase one of his rollout was certain outside activities like hiking and walking, and golf was added with certain limitations.
Okay.
And so we began the process of gearing up for reopening the golf course, which we now have scheduled for May 11th,
Okay.
Monday. It's going to get our team together this week, get it all prepped and ready to go, and they've been working on that real hard over the last couple of weeks to get the golf course in its great shape, and then getting the crew back ready with regards to how we're going to operate. And that's what I wanted to talk about a little bit. So on our website today will be all our new rules with regards to how we're going to operate, so people can go on and get that. It's pretty extensive. And the reason it's extensive is, again, we're meeting the protocols from the state and Orange County Health with regards to operation. So how you're going to have to call in advance to get your tee time and register stat, how you're going to have to pay with a credit card or put one on the system so that we have it on a continual basis. So it's a non-touch type of situation. We're going to require masks to be worn when you first get there before you tee off. Once you tee off, obviously you wouldn't have to at that point in time. And the key will be Tom and his crew will be with the expectation of social distancing. You're only going to allow 4 people to a group. Individual golf carts unless you have a partner. So it'll be either 4 golf carts, or if there is a partner involved, they can share a golf cart. The key is making sure that social distancing is there, making sure all of the activities are not touching stuff. So the interesting thing is, obviously we'll kind of raise up the cup, so you won't be putting into the cup and reaching down in there to get your golf ball. It'll just be hitting the cup. The flags will be still there. You'll never have to remove the flag.
Okay.
So there won't be any touching with regards to activities like that.
That's interesting.
And so the whole point is, you know, individually keep your own ball. Don't be sharing a ball, that type of thing. We don't want any sharing of activities, because that's what could potentially spread the virus.
Right.
So with these protocols, we believe that we can be safe for the community, get the activity open again. There will be some changes, like I said, in the sense of the process of how people can go through and get signed up. One of the things I wanted to mention was there are different times here for getting your registration or your tee time in a week in advance. Monday, Thursday, Friday, Saturday, and Sunday tee times can be scheduled 7 days in advance by calling at 6 o'clock, 6:15 in the morning, by calling 949-597-4336. That's the number at the clubhouse.
Okay.
And then Tuesday and Wednesday tee times can be made on the Saturday in advance of that at 10 o'clock in the morning by calling that same number, the 597-4336.
Okay.
And that's how people are going to get their tee times. And then what's real important is those residents are going to have their identification number, because this is residents only operation.
Got it.
There will be no guests at this point in time.
All right.
Again, we don't want to see the impact of people coming into the community. So it's just for our residents at this point in time.
Right, and I want to just kind of go over some of the things that you mentioned. So for instance, when someone has a cart and they have a partner, you're talking about someone that lives within the home with them,
That's
correct?
A living partner, as we defined it, with spouse or somebody significant that's living with them.
Okay, perfect. I just wanted to clarify that because then, of course, you said guest.
Good point.
No guest. Then the phone number is the one that we've been showing. So there'll be no online tee times right now.
Correct.
Okay. Now, you also mentioned where they can get all this information. So is that the Laguna Woods Village alerts.com website?
Yeah, our normal.
Perfect, the normal one. Okay, great. Good. And you haven't gone over all of the restrictions, the majority of the restrictions. Is there anything else?
Those are the main
Oh, is that it?
ones.
Okay.
I did want to mention that the driving range and the par 3 will be open at the same time.
Okay.
Same kind of restrictions.
Yes.
The spacing at the driving range, so there will be limited access at the driving range. Be aware of that. We can't have people piling up. So the key is once you're done, leave, exit, go over to the golf course if you have a tee time. But there will be limited space there because we're going to distance out, so you won't have all the spaces at the driving range be available.
Right.
So that's going to limit that access. Again, there will be a credit card type payment to get that access to the golf balls. And then with the par 3, the same thing. It's a walk up. It's not, people don't use carts there. But again, the social distancing is important, the same amount of people, limitation on how many can be in a group. And when you're going up to pay there, again, remember the social distancing. Remember to wear a mask in and around when you're paying and when you're checking in. And then once you're on the golf course, you can remove your mask.
Now, let's talk about the responsibility of, the staff at the golf course. So if someone came to the golf course and they had a reservation, but they did not have a mask, so what's going to happen there?
Well, basically, the purpose of the mask is just when they're first getting there and congregating. So we're going to, obviously, our staff will be indicating to them that if they could potentially lose their tee time if they're not following the rules.
Okay.
And so that's why it's so important for them to have their identification, to follow the rules, or potentially you're going to lose your tee time.
Okay, and I wanted to say that because we have made every effort to make sure that everyone in the village has a mask. So there really should be no excuse not to have one at this point.
That's how we see it.
Yeah.
And it's really about keeping not only you safe, but everybody else safe.
Exactly. Well, that is great news. I think it makes all of us feel a little bit better that we're making some progress to just kind of come out of this stay-at-home thing, because I think people we're just going crazy, and we really want to be outside.
And I understand that. And one of the difficulties and one of the emails that we get constantly is, what about the other activities? When are they going to open up? One of the things I wanted to mention was that, and I'll just show a picture of it. This is the plan that the governor came out with regards to his phasing, and that's on ca.gov. Coronavirus 19, and he talks about this phasing thing. And if you go on that website, you'll see all of the activities, outside activities that are allowed right now.
Okay.
But two of them that we get constantly getting calls on, swimming and tennis, are not on that list at this point in time. There has been talk. If you have your own personal tennis court, that's obviously fine, and your own personal pool, that's fine. But when you're talking about a setting that we have here in the village, tennis and outdoor pickleball, and those are not on the list yet. We anticipate that the governor, probably by the 15th of May, is going to start to move in that second phase, and we're hopeful that those activities can then be considered at that point in time.
Yeah. It's a little trickier. You know, you've got people who are together, doubles versus singles, and I mean, in your close contact holding a ball. I mean, there's
one ball, and it's going back and forth.
There's a lot more to that rather than golf. So good. Well, making progress nonetheless. So that's awesome. Good. Thanks for that. That's good. Now, I know that real estate agents became an essential type of I guess, business.
Right.
So now it's gone a step further. That's opening things up a little bit better.
Right. So again, when we started to put restrictions in there, one of the things that we did was not allowing the open houses, and those type of activities, because what we were seeing was a lot of people coming into the village that they didn't know if they'd been tested or not tested or any of those type of things. So there was a big concern about that.
Right.
So we put a restriction on that as of May 1st. We went back and evaluated it given where the state is at, and we also evaluated what we're looking at in the number of units. A lot of the units that are being shown or for sale are empty. They're not occupied.
Okay.
And so given that structure, we believe that if we allowed, and we are allowing starting May 1st, for real estate agents to show property by appointment only. That way they're not doing open houses where, you know, we're getting a lot of people coming in. But if you want to show a house, you can now start doing that May 1st by doing it by appointment only. There are restrictions there too, and a couple of them are following state guidelines with the California Association of Realtors, have an amendment that you sign off on. And then also with that, there is actually some rules with regards to social distancing, wearing face coverings while you're in the activity, washing your hands and cleaning up afterwards.
Yeah.
So those policies are still in place and are really expected to be followed. So we'll watch that carefully, make sure that we're not seeing all of a sudden an increase in activity that overwhelms our community.
Exactly, and we've actually spoken to a few real estate agents here in the community, and they are very aware, and you know, they of course don't want to not be able to show a house, so it seems like they're going to be following the rules.
And we want that because obviously it's a good economic thing for the community. We thrive on having real estate sales here. It's important for our infrastructure, and it's important for the improvement of the village.
Right, excellent. And then you've got a few numbers to share with us?
Yes, unfortunately, I would say that word in that the numbers went up quite dramatically. We saw yesterday 145 new cases in Orange County.
Okay.
The highest spike that they've seen since we've been recording it.
All right.
The amount of people that are hospitalized right now is at 190, which is the highest number that we've seen. So again, I think that's reflective. We've talked about it, reflective of testing first, and then starting the treatment process. But if a person gets sick enough, they're having to go into the hospital. I think that's that fourth level. But increased testing is going to increase the results.
Right.
That's good in some ways. Obviously, it's kind of sad that we're seeing that much of an increase. The village still is being very, very good and keeping in their low numbers. And I think that's one of the things to be proud of. I did hear this morning, though, out of Orange County that one of the things that concerns me is that kind of rest homes or nursing homes has had a big jump. There was like 4 nursing homes that had a COVID-19 cases, went up to 9. And so, again, it's our population base that is high risk. Not necessarily that we're congregated like a nursing home, but the fact that you get into a high-risk age group, it can spread pretty dramatically.
Right, exactly. And they are in a little bit more closed quarters as well. One thing that you can do on the website, which is the COVID one that we share all the time, ochealthinfo.com, is you can find the numbers per city, but as well as the age groups too. And yes, while our community is in that higher percentage, it's still a broad number. Meaning you've got 16% or 17%. I mean, it's not like 50% are in this age group. So don't be too worried about it. I mean, take it all, in as a whole.
It is. And it's important to look at it from that perspective. I think where it's showing up again and why we're so cautious here is that when it does get into our age group, the impact seems to be much more severe.
Sure, exactly. Well, good. Well, thank you. Great information.
And I wanted to mention one other thing.
Yes.
I think on Monday we're going to have Carlos Rojas, our security director come in and speak to you. We thought that would be important for him to not only get on TV and show his face because he's new to the organization, but also I think he has some information about what he's doing working with the Orange County Sheriff's Department and his team to make the community safe.
Yep, we have a meeting with him, interview with him, so that'll be great. And like you said, he hasn't really been on, but he's going to talk a lot about, like you said, security and things that they're doing here, and just kind of lay out a plan, I think.
I think that's great.
So, all right, well, good. Well, thank you. Have a great weekend.
All right, you too.
All right. And stay tuned right after we take a break. We're going to talk about masks, as if we haven't talked about them enough. Stay tuned.
To help stop the coronavirus, the CDC recommends to avoid contact with people who are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Avoid touching your eyes, nose, and mouth. Clean and disinfect frequently touched objects and surfaces. Stay home when you are sick, except to get medical care. Wash your hands often with soap and water for at least 20 seconds. For more information, contact the CDC. A message from Village Management Services.
COVID-19 is a serious respiratory disease. There are simple steps we can all take to stay healthy and protect our community. Wash your hands for 20 seconds with soap and warm water. Clean and disinfect frequently touched surfaces daily. Cover coughs and sneezes with a tissue or elbow and avoid touching your face. If you do have symptoms like cough and fever, stay at home and call your doctor. When we all do our part, we can keep California healthy. For more information, visit covid19.ca.gov.
Before the next earthquake, take 30 seconds to refresh your memory about these important disaster preparedness tips. Make a family emergency plan. Decide how you'll get in touch with each other, where you'll go, and what you'll do in an emergency. Build a disaster supply kit with enough water, food, and emergency supplies to last at least 3 days. It's important to have disaster supply kits for work, cars, and pets too. Find and fix items in your home that might hurt someone by moving, breaking, or falling during an earthquake. Know how to react safely when the ground shakes. If you're inside, stay there. Remember to drop, cover, and hold on. Drop down onto your hands and knees and cover your head and neck with your arms to protect yourself from falling objects. If you can move safely, crawl under a sturdy desk or table and hold on to one of the legs until the shaking stops. After an earthquake, help people who are hurt or trapped. Call 911 for emergencies only. Check your home for damage, including gas or water leaks, damaged wiring, or downed power lines. Protect your family and your home by making a plan, building a kit, and practicing disaster drills at least twice a year. Be sure to visit readyoc.org for more information on emergency preparedness and alertoc.com to sign up for emergency alerts and notifications. We want you to be prepared for a disaster just as much as you do.
Welcome back. So as we've been talking for weeks now about masks and more masks, we wanted to tell you why wearing a mask is so important. I found some really cute masks. You know, who would have thought that it would turn into a business? And I guess instead of a mask, they're calling it a facial covering because it's really not a full mask, or we'd be wearing Batman masks and everything else around here. So anyway, I wanted to go over why it's important to have a mask. So let's start with evidence. Consistently wearing a mask in public is associated with a 70% reduction in the risk of catching SARS, which was a coronavirus disease some time ago. And like COVID-19, it is a respiratory illness that is caused by the same family of viruses called coronavirus. Now, of course, the one we currently have, COVID-19, is attacking the respiratory system straight for your lungs. So look at some facts. Places with widespread mask use has seen greater success in preventing major outbreaks or reining them in. So that's a really good thing. So there's one other reason why you want to wear your mask. Then how they work. So masks reduce the spread of infectious disease by catching what they call microbes that are expelled by the wearer and protecting the wearer from microbes in the environment. So if you're sneezing or coughing and you have this mask on, it certainly will help keep that in. When we, as we said here, coughing, sneezing, or talking, it just expels air as well as, little droplets. So having this mask over here, your nose and your mouth, will prevent you from expelling that out, as well as if somebody is around you and let's say they don't have a mask on, then this is going to protect you from getting that in. So conclusion is, wear your mask, pretty much where you're supposed to be wearing your mask, as you all have been doing, and now everyone has a mask, so we should all be wearing it just like normal. It's going to just be kind of our everyday accessory, just like you put on your other stuff. So in any case, wear your mask, just like we're asking you to, and our government is asking you to, and I think we'll be in good shape. We'll be right back after this.
Important for you to get your financial house in order. And so it breaks my heart sometimes when I see widows that come in with $100,000, $200,000 to their name, and yet their broker has lost $200,000 or $300,000 in the market when they shouldn't even have been in the market. The most satisfying part that I find in working with retirees is when they come in on their annual reviews and the market has had a bad turn, and we know that we can sit down and look at them and say, you haven't lost any money.
I retired 18 years ago, and a good friend of mine says, hey, Gear, what the hell are you going to do with your time now? And the next thing I knew, I was a delivery man for Meals on Wheels.
To the homebound neighbors he's delivered meals to for 18 years, my father, Homer Gear, is the real leading man.
Hey, well, hello there. How are you today?
Okay, well, we didn't want to leave you without the answer. Real quick, I am the beginning of sorrow and the end of sickness. You cannot express happiness without me, yet I am in the midst of crosses. I am always in risk, yet never in danger. You may find me in the sun, but I am never out of darkness. What is the answer? The letter S. That's kind of tricky, but I love that one. That's a really good thinker. Just to give you an idea, today we have a movie at 2 and 7 p.m., and it's called The Green Book. So take a look at that fun movie. I think you'll really enjoy it. Have a great day in the village. We will see you tomorrow at 9 a.m. Bye-bye.
RadNet is the nation's largest outpatient medical imaging network, providing thousands of imaging procedures each day. RadNet has recently been asked by local hospitals to help provide outpatient imaging services for their patients, and RadNet is committed to supporting those needs. We are available to take your calls and schedule your appointments. To schedule an appointment online, visit myradiologyconnectportal.com or visit our website at radnet.com.